Moving forward, the chiropractic profession emerged from an unregulated and scientific era in healthcare over 125 years ago. Over the years, chiropractors have endured decades of prosecution and persecution and developed a mentality for survival. Following a protracted legal battle in the United States and a shorter non-courtroom challenge in other parts of the world, the discriminatory anti-chiropractic behavior on the part of political medicine largely stopped. Sadly, as Dr. Keith Simpson pointed out in 2012, to the detriment of the profession as a whole, some parts of the chiropractic profession remain mired in a 19th century mindset. This is particularly perplexing, considering the progress that the profession has made and the set of opportunities it now has. Today, I'm going to attempt to explore upcoming challenges and trends in the chiropractic profession. So, who am I? My name is Javier Muñoz Laguna. I am a 10th quarter student at Palmer College of Chiropractic West. I have the privilege of founding the FTCA club here on campus about a year ago. And let me be honest with you for a second. I was really looking forward to have Forward on campus this year. I was convinced it was going to be a life-changing experience, one of those things that transform you as a student. But I think it is also time for me to let go of it. Or maybe there is something in person in the fall, who knows? Outside the FTCA club, I also serve as a research club president, and I'm as well involved in the SACA Specialty Council and more recently in the Student American Association Research Committee. I'm currently collaborating in two research projects, one of them under the leadership of Dr. Ken Weber, DC PhD at Stanford Medicine, and the other one assisting Dr. Cooperstein, DC MA, here in San Jose. With that being said, and by definition in my role as a student, I am the antithesis of an expert. Matter of fact, I'm evidently the least knowledgeable person in this virtual summit. To make it even worse, English is not my first language, so some of you might have some difficulty bearing with me. So at this time, now it seems the perfect opportunity to quote Dr. Bobby Maybe when he states, number one rule is simple, do not listen to me. So context about this first slide. Jorge Bucay from Argentina is a psychotherapist and a writer and one of my favorite all-time authors when it comes to self-help and self-improvement type of books. He is gifted with providing readers with the ability to map happiness by asking three simple questions. Since chiropractic seems to be sometimes like a big and happy family, I think we really should start asking us these easy questions. Number one is, who are we? Number two is, where are we going? And number three is, who are we going with? So let's start with number one. The vast majority of rigorous research and historical records have focused on the spine as the most successful area of intervention with which doctors of chiropractic identify. With that being said, the usefulness of chiropractic in other areas has also been documented. TMJ, extremities, hip and knee, nutrition, you name it. Even though most practitioners might have mixed feelings about the idea of considering chiropractic interventions to be limited to the spine, reality is that low back pain is the number one cause of disability worldwide, with neck pain being the fourth on that same ranking. Being just spine practitioners does not sound like a bad idea, taking a look at these facts. Let's tackle another part of this identity issue. For managing low back pain and neck pain, as well as headache, chiropractic has already achieved mainstream status in many parts of the world, including the United States. In other areas, however, in which documented growth has to remain occurring, alternative medicine tends to offer more research opportunities. Chiropractic might need to be considered a combination of these two in most parts of the world, with different blends of these two domains depending on the location. Now, pain therapies or beyond, it is becoming more obvious the role of chiropractors as first contact providers, which goes beyond pain therapy. Since there appear to be shortages of primary care providers in some communities, especially rural and urban underserved, DCs may have an opportunity to be in the spectrum, somewhere between primary care providers and specialists upon referral, but always keeping patients' satisfaction high and lowering overall healthcare costs. The fact that there is no complete consensus and unity around these few questions indicate that the chiropractic profession might still be in some complicated teenage years, just like the boy in this picture. The philosophy issue. This is a big one because if what is said and done to a patient is unsafe or creates harm, appropriate professional investigation and penalties must occur. In other words, primum non nocere, but if you constantly nocere, there should be some legal implications. Chiropractic philosophy should be about putting the patient in the center of the equation, and it should be mainly about safety, effectiveness, and public perception. Chiropractic philosophy is part of the curriculum in educational programs across the world, yes. However, the way this part of the curriculum is taught varies drastically across schools. When beliefs that are metaphysical, purely speculative in nature, get on the way, students tend to create some dissonance between these theories that are presented and the evidence per se. Now, the concept of philosophy as a whole should not be treated as a dichotomy, in my opinion. And this is something that more straight chiropractors seem to promote. You either have my philosophy or you don't, in an attempt to make the word philosophy their own property. Students have the chance to use the time spent in philosophy class to embrace a belief system, as long as it is legal and ethical, and or learn about chiropractic history. On the other hand, I feel like if belief systems such as vitalism keep being over promoted in these classes, and this eventually has an effect on the future clinician choice of treatment interventions, the need for this type of classes should be reevaluated, whether that means modify them, eliminate them, substitute them, etc. The subluxation issue is another big one. The chiropractic community differs greatly on how subluxations are to be defined, and there currently exists no gold standard in the detection of subluxation. Professor Hartvigsen in Berlin last year stepped up to make clear that the concept of subluxation is unscientific. And I really wish I had been there, quite honestly, just to listen to him. Now, on the other hand, we got the straight traditional chiropractors like Dr. McCoy, who consider the medical diagnosis of disease to be unnecessary because these are viewed as secondary effects of vertebral subluxations. In essence, they believe that disease symptoms will disappear once the underlying subluxations have been corrected properly. Most straight chiropractors do not wish to have any association with mainstream healthcare. Chiropractors who have traditional ideas like this, of the spine being a source of all or most diseases, are unlikely to make the journey of integration. Now, is this just a marketing strategy? Is this just nocebo effect on steroids? So some common conditions listed as having a relation to the so-called subluxations are serious diseases and potential organ malfunction, a wide range of child-specific health problems such as ADHD, bedwetting, and colic, and a range of other issues such as stomach and digestive problems, asthma, allergies, ear infections, and blood pressure. In addition to the commonly expressed health issue of nerve interference, also called nerve irritation sometimes, other issues were identified by Marcon et al. To be constant in traditional chiropractors' website in Alberta, Canada, such as spinal decay or spinal degeneration. It was also common for websites to state that uncorrected subluxations prevent a body from functioning optimally and that a suboptimal body state will struggle to heal itself. I think the obvious solution to this conflict relies on strengthening regulatory bodies, and Canadians are or seem to be doing quite a good job at this. The advanced practice issue. DCs manage patients who already are taking or will take drugs while under their care. It is important to know the clinical effects of medications, especially with regard to the chief complaint with which a patient presents. There are very different laws across the United States governing the practice of chiropractic. The trend is toward broadening the scope of practice, broadening the scope of practice law to include prescriptive rights, and minor surgery might increase use of chiropractic services and increase social authority. A limited minor prescriptive license for DCs focusing on neuromusculoskeletal conditions, postgraduate educational courses and credentialing could be created and put in place fairly easy. The strong counterpoint to this idea from a lot of doctors in the field is that they do not want patients to come to us for the wrong reasons. And they rather take the patients out of medications rather than prescribe them. As I mentioned before, participation of chiropractors with minimal prescription rights in the healthcare delivery system could help to reduce the current shortage of primary care providers and to meet the needs of healthcare consumers who prefer access to a physician who can provide traditional chiropractic care and primary care with a fundamentally conservative approach. I do not have the impression that having access to minimal prescription rights would compromise our conservative roots at all, but that is just my opinion. The chiropractic, the chiropractor of the future. A study done by Dr. Shannon et al. In 2018, published in the BMC Complementary Medicine and Therapies, looked at stakeholders' expectations from the integration of chiropractic care into a rehabilitation setting. The first domain stakeholders expected or hoped chiropractic care would address was pain management, an important hurdle for patients, though not the primary focus of their rehabilitation process. Next, stakeholders anticipated the DC would work with the therapy team to assist patients in gaining functional improvement, the main goal of their hospital stay. Collectively and throughout their mission, families and healthcare personnel also empowered patients to achieve whole person healing. An additional domain, healthcare integration, illustrated by the wide bands between themes, described how stakeholders anticipated the inclusion of chiropractic services would impact the broader delivery of healthcare services within this setting. Stakeholders expected the addition of chiropractic care to a rehabilitation specialty hospital to benefit the patient through pain management and functional improvement, leading to whole person healing. These are some of the testimonials of the interviews carried in this particular study. Quote, if it's chiropractic something that helps with the pain, I think it's going to be a tremendous inclusion. This was said by a therapy staff focus group. Quote, minimizing the use of opioids and the other meds we use for pain would go a long way because all of those meds have side effects that hurt in other ways, and that's always a tough balance from the medication perspective. This was said by a medical staff. For some people, pain affects the therapy, and when your pain affects your therapy, that affects your ability to move on. I'd like to think that people's transformation and ability to get better would get faster and easier by adding a chiropractor. This was said by a nursing staff focus group. And there goes my favorite speaking about self-efficacy. Quote, each chiropractic program will also be somewhat empowering for individuals where the individual has to take charge of their recovery. This was said by an administrative staff. Dr. Stacy Salisbury and Dr. Vining in BMC Chiropractic and Manual Therapies in 2018 showed some very interesting results on qualities of the ideal chiropractor who prospectively would join the clinical staff of a rehabilitation specialty hospital in the United States. The preferred chiropractor for multidisciplinary rehabilitation settings was defined as a patient-centered professional who possesses clinical acumen, practices in a safe manner, and is informed about efficacious and evidence-based treatments for this patient population. Such a chiropractor would draw upon an emotional intelligence to offer comfort to persons with painful conditions, patients to people with complicated recovery journeys, and a familiar connection to everyday life through a friendly rapport. Future colleagues anticipated working with a chiropractor who was a team player, resourceful in his or her approach to solving complex clinical problems, and responsive to formative feedback about their role in the facility and with patient management. The preferred chiropractor also would express a personality that fits with those in the larger organization, meet all procedural and legal requirements, and share in the mission and values of the institution. This just sounds like the dream letter of recommendation for a student, the kind your own family member would write in a moment of inspiration. Now, is this also part of the future? Video visits are becoming the norm during this worldwide crisis in healthcare. Online musculoskeletal and lifestyle advice, coaching, education, etc. has certain surprising advantages over face-to-face. It gives people space to reflect on what they are learning, thus enhancing decision making. People are less prone to expect a quick fix and more likely to engage in self-care. Dr. Craig Levinson has been one of the main advocates of telehealth during this coronavirus pandemic. Not only is a master at finding the signal instead of treating the noise, as he says, he is able to create a positive environment and a positive experience with the patient through video. His ability to integrate the biopsychosocial model and promote self-efficacy just by asking the right questions in the right order, using motivational interviewing, is just extraordinary. He has made clear that high-value care has to do mainly with exercise, self-care, and education first, all of which can be done in video visits. Not only that, Dr. Levinson has been extremely generous at sharing his materials with in the way of webinars online on a weekly basis, something that students like myself do not take for granted, especially in this uncertain time. Now I'm going to speak briefly about Global Action on Disability, GLAD. GLAD Back is one of the worldwide rising self-management programs, an intervention that compiles elements of effective and generally recommended interventions into a standardized care package that is feasible to be delivered by clinicians in primary care interventions. This program is aiming to address non-prognostic factors for developing back pain-related disability. GLAD Back is founded on social cognitive theory, cognitive behavioral therapy, operant conditioning, and behavioral change theories, where patients face their individual challenges using exploratory approach and actively participate in tasks during both the education and exercise sessions. This program makes more obvious the need of adding essential psychology training into chiropractic curriculums. So far, the GLAD Back program has only been implemented in Denmark, but it seems to have the potential to follow the success of GLAD Hip and Knee, which was executed in Denmark, Switzerland, Australia, and Canada. Whether the GLAD program has a presence in other healthcare systems other than the ones just mentioned is still to be determined. The PSP certification postgraduate program trains and certifies qualified physical therapists and chiropractors to be responsible for the frontline diagnosis, management, and care coordination of patients with spine-related disorders. Primary spine providers are ideally suited for managing patients in the primary care setting or functioning as the frontline practitioner in an interdisciplinary spine program, managing most patients without the need for referral and coordinating the care of those who require other services. The PSP certification program consists of a total of 120 hours of instruction. The program is divided into 4 units of instruction, with each unit consisting of 2 parts. One is a set of online educational modules, 8 to 12 hours, and 2 is a weekend skill building workshop with 16 hours of learning, more or less, along with 2 supportive textbooks. The fact that this program is offered in a public institution of such a high level like the University of Pittsburgh is remarkable and sets up a trend toward future collaborations between chiropractors, physical therapists, and even doctors of osteopathic medicine as well, which are also eligible for the program. Since the size of the cohorts are limited to a certain number of applicants, I think the main challenge for the program is increasing the availability and expand to meet the demands of practitioners willing to take their clinical competencies to the next level. Of course, this is not an overnight event and might take some time. So who are we moving forward with? Probably the best strategy to use as a reference in terms of global research collaboration is the Chiropractic Academy of Research Leadership. The CARL program is a grassroots initiative about positive, forward-looking, credible academic leadership within chiropractic. It aims to link promising early mid-stage career researchers who are dedicated to developing high-quality evidence regarding chiropractic as well as a global research network. CARL facilitates training on a range of mentoring, leadership, networking, and research-specific skills relevant to early and mid-career researchers. Some of the CARL funders include the ACA, the Nordic Institute of Chiropractic and Clinical Biomechanics, Canadian Chiropractic Association, the European Centre for Chiropractic Research Excellence, among many others, including this circle in red. The Forward Thinking Chiropractic Alliance, a network of doctors who has become way more than just a Facebook group, as we will see in a minute. Now, about sustainability, because access to high quality spine care remains impossible in many underserved communities across the world. Luckily, world spine care is flourishing in countries such as Botswana, Dominican Republic, Ghana, and India. World Spine Care is a multinational, not-for-profit charitable organization founded in 2008 by Scott Haldeman, MD, PhD, DC, a leading figure in the assessment and treatment of spinal conditions, and also considered by many, including myself, the father of evidence-based spine care. It was launched to fill the profound gap in the evidence-based treatment of musculoskeletal and especially spinal conditions found in underserviced areas around the world. So, how can an initiative like this be sustainable? The ongoing sustainability of world spine care is realized through on-site health worker training, medical doctor training in the diagnosis and treatment of spinal disorders, train the trainer program enabling mentoring practitioners to pass on their skills to others, community education, academic scholarships for qualified residents, fellowships in advanced spine surgery and other medical specialties, and long-term partnerships with local ministries of healthcare and applicable regional healthcare system managers. The future of chiropractic relies in collaboration and partnership. However, this future strongly depends on getting great results for patients, results that are rooted in the best research and the highest levels of care for people. The FTCA network aspires to push for a future where chiropractors are the first option for pain relief. The future is bright. I am confident that the future for the profession is bright. We students have many reasons to be optimistic about our careers. Not only that, I predict that the forward-thinking Chiropractic Alliance movement will be an irreplaceable tool in the spread of progressive chiropractic thinking around the world. I'm going to finish with a Carnegie quote that might resonate with all of you forward thinkers. The best time to expand is when no one else dares to take risks. Thank you so much for your time and attention, and thank you for everything you do every day for your patients. Thank you. It has been a pleasure in my part. Thanks.